Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, this is Michael P. Coleman, Content Director for Brother Be Well. 70% of us experience some type of traumatic event over the course of our lives. That's over 223 million people. And many of us are walking through our days without seeking treatment for it. About 6% of the US population, or 15 million adults, experience post traumatic stress disorder, or PTSD, during any given year. In one of a series of Brother Be Well conversations on trauma and healing, made possible in part by Blue Shield of California's Blue Sky Initiative, we're speaking with marriage and family therapist and Brother Be Well clinical advisor Christian Jacobs about just what trauma is, signs that might help you determine whether or not you or a loved one are experiencing trauma, and an overview of trauma mitigation techniques and strategies. Christian Jacobs, Brother Be Well clinical advisor, welcome back to the platform, my friend.
Hey, Michael, how's it going?
Really, really good to see you again. Really good to see you. You ready for this conversation?
I'm ready for this one. This is going to be a great one.
It's going to be a great one. I got the tissues ready. Let's try to keep it together and get through this. I appreciate you, Kristen. Let's get
Most
into that
definitely.
first question, if you will. When I started my own mental health journey a couple of decades ago now, I most often heard the word trauma to describe a physical blow or injury. That usage is absolutely accurate. But for the sake of this conversation, let's look at trauma through the mental health lens. What type of trauma are we talking about today, Christian?
Michael, today we'll be talking about different types of trauma, right? We're looking at, the trauma bonding, which I'm sure some people have heard, PTSD, as you mentioned earlier, acute stress disorder, trauma, actually chronic trauma, and also toxic stress. These are a few of the things that really go on within our body, and also how it impacts our relationships and how it impacts our mental health. We'll also be really getting into some of the many ways that people experience trauma, through experiencing and witness, violence, through physical, whether that's physical or emotional, and actual spiritual sometimes as well. Some of the trauma that individuals experience in church, it may be a negative experience. Some people see these billboards, going around saying, "Have you been abused by a priest," and things of that sort. So there's trauma that lies in several different areas, and also there's another one too that a lot of people like to leave out, or not like to leave out, but they may leave out by accident, is emotional, painful events too, and also those social determinants like poverty and discrimination, and how a lack of resources can induce trauma. So that's really the area that a lot of folks sometimes leave off in terms of really looking at to see, how trauma exists in those areas of social determinants.
Did a little research getting ready for this particular conversation. What are some of those specific experiences that can elicit and do elicit a trauma response?
Well, Mike, there's four types of trauma responses, right? And the funny thing about it is that a lot of people usually hear flight or fight, but then after more research has gone into some of these this phenomenon, freeze was added as a trauma response, and now fawn, FAWN, which was recently given. I can give you an example of that. So, for example, and we'll talk about it more later on, but fawning is really when you experience trauma, instead of fighting it or running or freezing up, you tend to turn into this person who likes that individual. And we'll talk about more about codependency and relationships and things of that sort. And also, when a person goes into those modes, that fight, freeze, or fawn mode, something happens chemically in our body. Something really does start to occur without our consent. And cortisol, which is a stress hormone that's released from our kidneys, it's released from the body, and it's actually it's a stress hormone. So once it gets to the metabolism, the whole purpose of that is to help you, fight off whatever you're afraid of. So that cortisol helps you with your adrenaline. It helps you your pupils dilate, so you can see your target or whatever's going on better. Your breath changes, so instead of taking deep breaths in, your breath shortens. So that adrenaline, that cortisol, causes your breath to breathe faster, so you can take in more air to fight whatever you're fighting off, that perceived threat. And that's really why people instinctively open their eyes when they're surprised or scared, and they're like, that's an essential thing, because their body is essentially, opening their pupils to see the threat, even though we don't see it that way, we're either excited or scared. And the thing about it, Michael, is that too much of this chemical can really lead to several health issues. That's the unfortunate part, such as weight gain, blood pressure issues, and hypertension. And here's the thing. The crazy part about it is a lot of people stay in this fight, flight, freeze, or fawn mode constantly throughout the day, and they don't even know it. They have no idea. So many times, guess who those people are? They're people of color. So people who live in neighborhoods where they may experience or witness violence on a daily basis, sometimes they stay in this fight or flight mode all the time. Their body is constantly releasing cortisol. They're constantly, their heart rate is constantly rapidly racing. And so just imagine what that does to the body over long term, which is why, African Americans and Latinos are more susceptible to hypertension, because we stay in these flight modes more often because of the social determinants that we live in. So relationships can really elicit, a fawn response, as I was talking about earlier, and a person could have been in a codependent relationship, physically or emotional abusive relationship in the past, and they find themselves having flashbacks from those traumatic events, have occurred, such as negative feelings or from a domestic violence that may have happened in the past. So fawning could be really losing a lack of identity of self. They lost themselves and they became a people pleaser.
Touching on a few of the different topics that we're going to explore throughout this entire trauma and healing series with Blue Cross Blue Shield. So thank you very much for that. Can't wait to have this entire series of conversations with you. For the sake of this one, I want to ask you a quick question, and I hope I got this right. I understand there are three different types of trauma: acute trauma, chronic trauma, and complex trauma. If I'm right about that, can you help our Brother Be Well family differentiate between those three types of trauma?
Well, you're absolutely right about that, Michael. There are three types of traumas, and now I'll break down basically how they look and maybe give a short example. For acute trauma, this really results in a single incident. So acute trauma, and based on the DSM, right? The DSM, the Diagnostics Statistic Manual, basically what clinicians use to diagnose someone with, PTSD. Acute trauma is the precursor to PTSD. So acute trauma is when something happens and they're experiencing traumatic symptoms within that first month of the event. So say you get into a car accident, and within the first week to the fourth week, you're having flashback of the event, but they don't go any further than that fourth week. That's called acute trauma in the DSM. PTSD is at least the event has to happen at least a month ago. So you can't diagnose PTSD right off the bat. So if someone comes into my office and says, "Hey, I had a car accident a week ago," clinically I cannot diagnose them with PTSD until a month has passed, because the brain and the body is taking time to actually process that. And so a lot of those symptoms, the nightmares, doesn't really come out until a month later. So that's acute trauma. Chronic trauma is really a repeated and prolonged abuse, right? Or that traumatic, such as domestic violence or abuse. Someone who's experiencing that trauma on a regular basis. Someone who's really kind of going through it and seeing it daily. And complex trauma is really kind of what it sounds like. It's exposure really to a variety of multiple traumatic events. And those are usually often like invasive or impersonal in nature. So a lot of children may experience complex trauma through either like sexual abuse, different types of abuse that occurs, physically. So those are how those three different types of traumas look, and sometimes people can experience all three of them at the same time, which could be very difficult for someone to deal with.
Oh, you read my mind. I was going to ask if they can be experienced concurrently. So you're saying they can be. Wow.
Absolutely, they can go in patterns. Sometimes someone can have a complex trauma, and through their through treatment, maybe it's subsided a little bit or baseline to where it becomes it's not as complex, or maybe not chronic now, where it's happening, sporadically or intermittently.
Really appreciate you walking us through that, Christian. This next question I've got for you today, as we begin to explore trauma, I'm asking it for me and every other parent that might be watching this particular video. Can yelling at a child elicit trauma or cause trauma?
Oh wow, the impact of yelling. Well, children. We're speaking children in particular. Children and adults, basically, and adolescents, they pretty much handle trauma differently, and the body really handles trauma in a different manner. But and for the sake of this topic, children really are particularly vulnerable to trauma because of their rapidly developing brain, and their brain is really developing. So a lot of these chemicals that we talked about, the adrenaline, the cortisol, things of that sort, are constantly in development mode. The amygdala in the brain, the frontal cortex. So changes in the brain development. So during a traumatic experience, the child's brain is really it's at a higher state, it's at a heightened state. So their brain is really sensitive to traumatic events. So the fear-related hormones are activated. So for an adult, for those chemicals, it wouldn't be as serious, because those chemicals have been released, and maybe we've experienced it before. We know what it feels like. We've maybe been desensitized to them or used to it. But for a child, these chemicals are new to the body. So when you look at that, stress is a normal part of life, right? So when a child is really exposed to the chronic trauma, like abuse or neglect, the child's brain really remains in this heightened state of pattern. We talked about kind of like earlier, they stay in this heightened pattern, but obviously they don't have those communication skills and coping skills to deal with it. So remaining in this heightened state can really change the emotional behavior, in the cognitive functioning and the developmental period. And so the child is really trying to, what's the word? They're really trying to stay in survival mode. They're really trying to figure out, how do I survive through this traumatic experience? So the fortunate part is really the child is exposed to trauma over time. So you're looking at their response system. You're looking at how their behaviors are, how they emotionally behavior. They're trying to cope with all these things while taking everyday life. There's an example that in a lot of trainings for social workers and therapists, where they watch this video, and it's a video that a wife agreed to allow to record her domestic violence situation. So she basically kept a camera in the home, and she recorded her domestic violence incidents with her husband. So one clip, you would see, the wife holding the baby, and then the father would come in the house, and they would get into an argument, and they would fight, and they would yell, and then the baby would go crazy. The baby would scream and cry, and basically just have a fit. The next day, same thing. The woman's holding the baby. The man comes in. The baby doesn't cry as much. Then the next day, the man comes in and yells and screams at the woman, his wife, and the baby barely cries. The last clip shows the man coming in and yelling and screaming and actually pushing on her, and the baby's not even responding after that fourth time. And our research shows that exposed time of trauma, that your body becomes desensitized to it, where you're not even responding to it. Biologically, your body is, the cortisol is being released, your body's going through the whole fight or flight, but emotionally you're not, you're desensitized to it. So that's just a really good example of how yelling can really impact children.
Two things here before we go into that next question, Christian. You've touched on children. You've talked about it a lot. I can't wait to get into a whole separate video that we're putting together. We're going to talk about ACEs, or adverse childhood experiences, in children. So can't wait to get into that with you. But I just want to check in here. Are you saying that, it sounds like you're saying with regard to kids, that the cortisol, for instance, that kicks in, that's typically a good thing, and it's a biological thing, and it's set up to help protect us from harm. But when there's no real harm that comes, or when someone stays stuck in that prolonged period for too long, that's when it gets, that excess cortisol over a period of time is what can really cause those problems. Is that accurate, or do I have it, or no?
You have it, and that's where the somatic issues come. That's where the physical and the biological conditions come in, where we're talking about hypertension and stress and weight gain, because cortisol, the cortisol chemical can induce weight gain. So that's where a lot of these, when you go into a doctor's office, they ask you about, what's your stress level, what's going on with you, because it can really affect you. It can start to affect you physically. So that's where the mental and the physical are married, and they come together. And that's why a lot of the mental health and the physical health with your primary care doctor, that coordination of care is so crucial and so important, because both of those professionals should be in communication, because it can go either way. You don't know where that stress or that mental anguish is coming from.
I again, thank you for that, Kristen, and can't wait to get into that whole conversation about adverse childhood experiences and what that toxic stress can do and is doing to children, and particularly, as you pointed out, to children of color, more so than some of our white counterparts. Can't wait to get into that with you here at Brother Be Well. Let's get to this next question. This is another one. It's almost a rhetorical question. Let's talk about toxic relationships. Can they cause stress, romantic or otherwise? We find ourselves in relationships that might not be great for us, and we don't realize they're not great right away. This is how we wind up in them. Can they cause that toxic stress response that we're talking about?
Yes, the short answer is absolutely. A toxic relationship can really do more damage than you think. Actually, really, a toxic relationship can cause trauma bonding, and trauma bonding is something I talked about earlier. And trauma bonding is really, just to kind of give a short breakdown of that, it's a psychological response, really, to abuse. So it occurs when the abused person really forms an unhealthy bond with the person who abuses them. So toxic relationships are rooted in cyclical patterns of, there's a curve. So there's a honeymoon phase, right? And everything is great and everything is good. And then there's that emotional, where there's conflict and there's issues and there's fighting. And then there's maybe the abuse that happens. And then that curve, it goes down. Then there's maybe sexual abuse or whatever abuse you want to look at. And then it goes back up again. And that's the cyclical pattern of domestic violence and abuse. So traumatic experiences in a relationship develop into these toxic relationships that we're talking about. And really, as a result, the abuse in a relationship can really develop traits like people pleasing, as we talked about earlier. These are some of the signs that maybe your relationship could be, either toxic, or it could be in that mode of trauma bonding. Deferring your needs of your partner, so we're not really even looking and caring about what your needs are in a relationship. Enmeshment, so there's disengagement, where you have two people in a relationship who are not close, they're not connected. They don't talk, they're not emotionally there for each other or physically. And there's enmeshment, where you have a relationship, they're too involved, they're too close. Parentification is another way enmeshment looks, where you have a single mother, and maybe the single mother has a son, and due to the father not being in the home, they may provide more responsibilities to that son, which causes parentification, where instead of him playing the role of the son, now he's playing the role of the absent father. So that's another example of enmeshment. And then also abandonment issues. So these are some of the imperfect storms of symptoms and diagnosis that could occur. That can actually create this picture of trauma bonding. And really, the first sign of conflict you find trying to appease the angry person. That's another sign too. So someone gets in an argument, you're in a relationship, someone's arguing with you, and it's pretty clear they're in the wrong, and you find yourself trying to appease that angry person who's in the wrong. That's another very common trait of people pleasing and also trauma bonding. So the traits I really listed is just also a definition of that codependency that we talked about. It's kind of codependency is like the overarching theme of all of this. Where those enmeshed relationships, when one person loses their sense of self and independence and believes they need to tend to someone else's needs before their own. So that's really several ways how it affects relationships.
I appreciate that overview, Christian, really do.